One of the biggest problems is treating the infertile man, and I'm going to tell you why. I'm Dr. Malpani, I'm an IVF specialist. Our website is www.drmalpani.com and our clinic is Malpani Clinic in Colaba in Mumbai, and I've been an IVF specialist for over 30 years. Now, typically, an infertility specialist is a gynecologist, and a gynecologist by definition is someone who specializes in treating women with medical problems or female diseases. This could be childbirth, could be abnormal uterine bleedings. We do things like cesarean sections and hysterectomies. Of course, as gynecology became more advanced, a lot of gynecologists super specialized and became infertility specialists, which means you would treat the infertile woman. So you would do things like laparoscopies and tubal surgery, and as technology became better, you did IVF as well. So it was fairly clear that you treated the infertile woman as an IVF specialist. But obviously, it's not just the woman who has an infertility problem. It's always a couple who's infertile, which means often the problem was with the man and not with the woman. Now, when you had an infertile male, that created a certain amount of complexity because gynecologists weren't used to examining men or seeing men at all, and they knew very little actually about how to deal with these problems. So typically, they would then refer this infertile man either to a urologist or now a urological super specialization called an andrologist, who is technically a male infertility specialist who is responsible for treating these men. But guess what? They actually found out that there was very little specific treatment which andrologists or urologists could offer these infertile men. Sure, they would give them treatments like fertility and Zevet and antibiotics and antioxidants and low-dose clomiphene and do things like varicocele surgery, lots of stuff. Because after all, if you went to a specialist, he was supposed to do tests. But the reality is none of these tests actually helped, which means they would end up referring this infertile man back again to the IVF specialist, saying, hey, look, there's nothing much we can do for him. What you need to do is treat this couple who has a male infertility problem with IVF, or preferably with what is called ICSI. Because with ICSI, no matter what the man's sperm count is, we can take a single sperm and inject that inside the egg. So ICSI was the final medical pathway for treating any male infertility problem, which obviously made life a lot simpler in some senses because you then just needed to go to an IVF specialist to solve your problem. But tragically, what used to happen is, because obviously andrologists don't want to feel out of the loop and they are specialists, they need to do something, which means a lot of these infertility specialists would refer these infertile men back to these andrologists, and some of it was you scratch my back, I'll scratch yours, which means when I have an infertile man, I'll send him to you, and tomorrow you have an infertile man who needs IVF treatment, you send him to me, which is great for the andrologist or the urologist and the gynecologist and the infertility specialist because they could cross-refer patients to each other. It wasn't very good for the patient who was treated a bit like a shuttlecock from one side to another side to a third side, and this ended up with a lot of unnecessary over-testing for the poor infertile man, and I think that's become a huge problem today. A lot of men are being made to do a lot of unnecessary tests. A lot of sperm tests, for example, are being done unnecessarily, which means if the couple's not even been trying for 3 months or 4 months, the man is asked to get a sperm test done. Completely pointless and useless. And what's worse is when the man has a sperm problem on the first sperm test, rather than repeat the sperm test after 6 weeks, which is the right thing to do from a reliable lab to see whether he actually has a problem or not, you need to document this. There's a whole battery of tests ordered for these infertile men because effectively, hey, look, we spotted the problem, it's you who have it, you're an infertile man. So we send you to a urologist who will then do an examination, send you for an ultrasound, a Doppler ultrasound to look for varicoceles. We'll do a lot of blood tests like FSH and testosterone, and then do additional sperm function tests like anti-sperm antibodies and DNA fragmentation, all of which are completely useless because they don't change the treatment options for this poor infertile man. The tragedy is no one applies their mind, no one thinks. Doctors don't think, yes, what am I going to do differently based on these results? Because doctors are so focused on treating the abnormal result that they forget that what they're treating is actually an infertile couple who needs clinical care. And the tragedy is often the gynecologist is not even very interested in treating the infertile man. She leaves everything up to the andrologist, who ends up wasting 6 months treating this poor man with lots of drugs which have no use at all, don't help him at all. Perhaps they might increase the motility a little bit, perhaps they might increase the count, but conversely they may decrease the count or decrease the motility, and these poor patients get completely frustrated. The poor man feels guilty and impotent and inadequate, and he gets shuttled around. He feels, oh, it's all my fault that my wife can't get pregnant, which is a real tragedy. What does this all mean? Rather than getting shuttled from one sperm function lab test for doing things like CASA or sperm DNA fragmentation, all kinds of exotic tests which tell us nothing useful at all, from a gynecologist to an andrologist, you need to take control of what's happening to you. You cannot leave everything up to a doctor. And the best way of doing this is what I call information therapy. And the great thing is there's lots of reliable information available for the infertile man, including what sperm tests to do, how to do them, which are useful, which are not useful, why sperm DNA fragmentations are completely useless, what IVF and ICSI is, why varicocele surgery doesn't help. You can find all this information on www.drmalpani.com. And because it's my website and I've authored this information, I can assure you it's reliable, updated, completely free of jargon. So you can become an expert and you know what questions to ask your doctor, and you'll be able to make out if this doctor is answering your questions properly or not. So please check out our website, and if this information therapy helps you to have a baby, nothing will give me more joy and pleasure, because that's the reason I became an IVF specialist, to help infertile couples like you build their family. See you.